Now, the UK is getting poorer and sicker. That's the damning conclusion of a new think tank report shared exclusively with this programme. A record number of people in this country are economically inactive because of ill health. And the report from the Institute for Public Policy Research shows that a disproportionate number of these people are concentrated in just 50 of more than 300 local authorities in England and Wales. Our health and social care editor, Victoria MacDonald, has this report.
Poverty and wealth side by side, the Merseybank estate dwarfed by the towering offices on the Manchester skyline. And on either side of that divide too, wellness and illness, employment and unemployment.
You sink into this cycle of despair, of what can I do? I feel useless, is the word. Felt very useless.
Recent data shows record numbers of people out of work because of ill health. Now a report out today says that 1 in every 4 people who are economically inactive, that is not seeking employment, live in just 50 of England and Wales's 339 local authorities. Drilling down, in Manchester, for instance, they're twice as likely to be economically inactive and nearly 3 times more likely to be in ill health compared with West Oxfordshire.
Take somewhere like here, the Merseybank estate. They're getting up to 2nd and 3rd generations of families who have not had employment. And along with that goes chronic ill health, that health and wealth divide.
Suzanne Mackay recognises herself in those statistics. Made redundant in 2019, depressed with weight problems, caring for her father until his death.
It's all right, people say, oh, you can get another job. It's not easy when you're older and you've got some issues to deal with. It's not easy to get out and go, you know, for people, because they feel like they have no purpose in life. They feel displaced.
It was her GP who sent her to Be Well, a social enterprise that recognises that poverty and unemployment are caused by multiple issues. She had counselling and coaching, help with writing her CV. She was helped with her weight gain and getting her confidence back.
In all my time working in my adult life, this was the only time I felt like I couldn't work emotionally, mentally, and I just needed that bit of support to help me through that. Because I know there's light at the end of the tunnel. I just needed that to help me.
Hello, it's Siraj calling from the Be Well service. How are you doing today? You okay?
It starts like this with a phone call, but it can take months or even longer of intensive work.
Sometimes you need someone else to sit with you and break that down and look at all of the different areas of life. So we would look at all of the areas around their housing, their health, money worries, also around the kind of who's around them in terms of that community and family support.
Be Well is supported by Manchester City Council, which has a long-term strategy for tackling inequality and ill health gaps.
For us, it was trying to take a long-term view to tackle some of these historic problems that for generations people have said are too hard. Against the backdrop, of course, of reducing revenue funding in local government and the struggles that we see in the NHS. But coming out of COVID, when COVID exacerbated many of the inequalities that we've seen, it felt to us that it was too big to not do something about.
And today's IPPR report suggests going further, local tax-raising powers on things like alcohol, junk food and tobacco, funding new good health schemes and recruiting public health specialists. Thinking differently, they say.
I think that we've got a huge health problem in this country, and it's the legacy of not having taken public health seriously for long enough, for not making health a national asset, and for having in these sorts of communities far too many people who are carrying many different diseases that mitigates them ever really being able to hold down a job because they're either caring for someone else or struggling with their own health.
I can't believe 4.5 years have gone. you know, and actually back into work, and it's an amazing experience. I'm absolutely excited about this.
So we're going to start off with your show around this morning, Suzanne, as part of your induction.
And this was Suzanne's first day at her new job at the Barlow Moor Community Centre on the Merseybank estate, helping others find their way, just as she was helped.
That report from Victoria MacDonald.